I had actually had experience with several psychotic patients when I was working in Prague. Actually, with a significant success, where I came to the conclusion somehow that the experiences that you see in spontaneous episodes of non-ordinary states can be therapeutic if they are supported, if they are sort of properly correctly understood and properly supported. And part of this actually goes back to traditional clinical psychiatry, where you have repeatedly reports that some of the very acute psychotic episodes actually are those that have best results, and in some instances there could be an improvement actually in comparison with the pre-psychotic state, whereas those that are slowly developing and they have few symptoms and so on are not as dramatic or as rich, those have the worst prognosis. And yet our whole therapeutic effort is to slow these things down and stop them rather than to accelerate them. So when I became aware of this, then we started actually using LSD to accelerate that procedure, with the idea that people can get through that rather than suppressing the symptoms. So actually some of these I described in the book. When the Impossible Happened, there is a case history of a woman whom I called Milada, where this was quite remarkable how she changed, how she transformed through the psychedelics. There was another patient who is described in Realms of the Human Unconscious, but not in any of the recent books. I would not give LSD to somebody who's paranoid. These were other types of, at least not paranoid in the sense where they experience enemies, and you have a good chance that you would be included in the enemies and so on. I would have to have the feeling that I have a decent contact, working contact with the patient. Again, in the work with alcoholics and heroin addicts, narcotic drug addicts, remain to the more successful studies. For example, a large study that we did at Maryland, it was over 140 patients from the alcoholic rehabilitation unit of a state hospital. So many of them would fit the category of Skid Row alcoholics who had undergone withdrawal in the alcoholic rehabilitation unit at sessions with us. In about 52% were considered to be essentially rehabilitated by an independent team. In that study, we had to have two teams. One was the therapeutic team, where everybody had psychedelics, but they wanted, NIMH required an independent team of people who had never taken psychedelics, because they believed once you take psychedelics, you impair your judgment and you cannot evaluate your own results. So the team that saw the patients before and after but didn't treat them independently concluded that over 50% of them were essentially rehabilitated at 6 months. Then we had a 12 and 18 months follow-up where it went down, but part of it was also that the patients moved and they couldn't find them for follow-up and so on. In the narcotic drug study, it was over 30%, which doesn't seem a lot, but those were patients, who if they were not treated, like within a month, they would be probably back on the street. Yeah. In the history of psychedelics, you have these two models. One is the psycholytic, which is lower dosages, medium dosages, but a whole series of sessions, and then the psychedelic model, which is a limited number of high dose sessions with, with eye shades, headphones, powerful music, and going for a kind of a single overwhelming type of an experience. Now, I have done both. Early in Prague, I was coming out of the psychoanalytic model, so I did a lot of these psycholytic type of sessions. And they were, for me, were extremely important for mapping the unconscious, because you can go layer by layer. One of my clients called it onion peeling of the unconscious. How things are interconnected in the unconscious, how they are related to symptoms, at which point, the symptoms would be changed, and so on. And the patients were allowed to keep their eyes open for significant parts of the sessions. So I have a lot of records about patients seeing the environment elusively transformed, or me transformed. And I wanted to know why at a certain point they saw me as a jaguar, and in another session they saw me as a supreme judge, and why the environment was death row at one point, and a bordello or a cottage in the Pacific. And so in the first book, Realms of the Human Unconscious, I spent a lot of time in sort of talking about these kinds of mechanisms. But I also realized that it was not most effective therapeutically. So in the work that we did in Maryland, the high dose and internalized sessions, they seemed to be much more effective therapeutically, but you don't understand why people change. So I think I had the advantage of being able to work with a model that offered faster results, but kind of fill in what might be happening from the observations from my earlier research. I think there is there's a role for plant psychedelics if you are not a researcher. If you are a healer, then you're in great shape. If the research you get into the problem, how much of the substance was there, what kind of substance is it just the substance you are interested in, or what about the interaction with these others? And we know that in peyote there's not just mescaline that can have effect on the body and the mind. So I think we know from history that you can do very powerful healing with psychedelic plants, but I don't think it would be the best situation for research. I find the MDMA, MDA to be most useful in work with couples, or work in situations where people had some really bad experiences with humans, like a rape or some kind of a hostage situation. I've seen, in the early years when we worked with MDA, or at the time when MDMA was still allowed, was sort of used by many therapists, that it really was very useful for couple therapy, and even people sort of sharing that experience, looking at each other and discovering each other's cosmic status, so to say. So I think that there is a particular place for that kind of work with the amphetamine-related substances. Ketamine, again, I found myself extremely interesting. I mean, it takes you to places psychologically that are, in a sense, far beyond like LSD or mescaline. Very, very strange worlds. For example, experiencing consciousness of inorganic objects. I had a session in which I was identified with a ski boot of a cross-country runner when I was experiencing the tensions in the shoe in my body. Or I had another experience where I would be and the end of a burning candle. And I sort of understand why you burn candles in a church, that it really has something to do with your ego melting before you have a spiritual experience. So what was happening in the candle was a very sort of a mystical spiritual experience and so on. I didn't find ketamine that transformative or that useful therapeutically, but it certainly shows you that the world is much wilder than you have ever imagined in your wildest fantasies. I think ayahuasca, obviously, is a very powerful healing substance, sacrament. It has sort of centuries of use. The same with peyote. I mean, we have our inspiration for the alcoholic study came actually from the success that they had in the Native American church with alcoholics. I'm not sure that you can sort of specifically define categories of psychedelics which would be like specific for certain diagnoses. We also don't have a broad enough spectrum of experience where we could compare, to have patients with a certain problem treated by different psychedelics and be able to compare it. So we all work with very selective kind of, samples, and it's very difficult to make any generalization from that. Well, what we have discovered in the work with psychedelics, and then later, actually the same in the work with the holotropic breathwork that Christina and myself developed, is that there is an aspect of not only psychosomatic disorders, but many disorders which are considered biological, where the problem is really energetic. I think we underestimate tremendously energy blockages of bioenergy as the source of pathology. I think Chinese medicine has a sense of that if your qi, if your vital energy is flowing, you have the best chance of remaining healthy, or that sort of making the blocked energies move is something that's important for healing. We have, for example, seen repeatedly that people who have what we call chronic infections, sinusitis, pharyngitis, tonsillitis, bronchitis, cystitis, are not really infections. The problem is the vitality of the tissue that has to do with the bioenergetic blockage that's also associated with vasoconstriction. So that you don't have enough antibodies, you don't have enough lymphocytes, leukocytes that come into that area, so that they cannot kind of keep in check the bacteria, which mostly are normal inhabitants of those areas. Those are not sort of vicious, virulent bacteria. Those are bacteria which are there normally, but as long as the tissue can protect itself, you don't develop the infection. So the infection is really is a result or is a consequence. It's not it's not the cause of the problem. So we have seen when, for example, in the breathwork, people who have this problem do the faster breathing, that they develop blockage in that area, and then if they continue to breathe, then the blockage releases, and then you see those infections clearing. We have seen something similar in Raynaud disease, but at least 15 cases of Raynaud disease where what you find behind it is really energetic blockage that causes vasoconstriction, and then all the skin problems and the problems with temperature and all that that you see. We have seen that in asthma, something very similar. You can work through asthma using this kind of a bioenergetic work. Well, I had many experiences in my psychedelic sessions when I was sure it has already happened to me, and that I was very, very surprised when I sort of ended up in the same place where I had the session, because I had the feeling it could end up somewhere else. So my current sort of idea about what might happen is that you simply moved from this organization of reality that we experience in everyday life, and you move basically into some kind of a rich matrix of transpersonal realities. I think all those things described in religious literatures are real possibilities. I mean, hell, paradise, purgatory, experiencing, animal consciousness, plant consciousness. I mean, we have all had those kinds of experiences. Now, whether this is going to be really happening at the time when we die, is an interesting question. It might be, if the universe is really the cosmic game, Leela, there is always place for surprises. Maybe it's just the curtain goes down and says, "That's all, folks." We know that people who had near-death experiences came pretty far, but it's only about 30% who at least remember it or report that. Not everybody experienced any kind of a vivid sequence of experiences when they came close to death. I think it's a good guess that it's going to be something like what we experience in these holotropic states, but again, we can compare it only with the experiences of people who came far but returned. We don't have any reports from those who completed the journey. Well, I think it's to the extent to which it's going to take us into this transpersonal world. Certainly anything that you do with kind of a responsible work with holotropic states is a good preparation, is training for dying. So I believe that, the shamanic work, the cultures that have rites of passage, the ancient mysteries, or some really significant systematic spiritual practice where you have these kinds of experiences, can be seen as an experiential training for dying. Abraham Sancta Clara, who was a 17th century German Augustinian monk, said, "The man who dies before he dies does not die when he dies." And there are some reports about the Eleusinian mysteries where they were saying, that it really radically changes your understanding of death, your attitude towards dying. And if you can change your attitude towards death, it also changes your way of being in the world. And we have seen all those things we have seen. So I really believe that it's a good possibility that it is a training. We have seen it in people in near-death experiences. Again, we had several people in Maryland who first had sessions with us where they experienced death, rebirth, and had transpersonal experiences. And then as the disease progressed, they actually had a near-death experience. Like one of the patients had an obstructed ureter, and they did an operation to open it up, and he had a cardiac arrest. And then we saw him afterwards, and he says, "I'm glad I had these experiences because the territory was not new to me." He says, had I not experienced it in those sessions, I would be really scared. But again, it's a person who came back. Yeah, I mean, we had, just numerous examples of that in the work at the Maryland Psychiatric Research Center. I was really the most moving part of the research that was being done there. It was quite amazing to see, again, from one day to another, the kind of change that you can see in the attitude towards death, the reduction of the fear of death, the narrowing of the spectrum to the present, because much of the suffering in cancer is not just the current situation, but the anticipation of how bad things get. You know that this is a progressive disease, very likely fatal disease, and you expect that things will be worse tomorrow and next week and next month and so on. And the people were, many at least, were able to sort of assume a kind of attitude towards life which is recommended in the 12-step program. You know, how am I doing today? Is this tolerable? Can I make it through today? Okay, I can, and tomorrow is another day, rather than, you know, looking at what's going to be half a year from now. So there were real changes in these patients, and I think if, you know, no other category is kind of allowed, you know, to undergo psychedelic treatment, there's certainly no reasons why this should not be offered to cancer patients. Well, again, to me, the idea of life after death is like a series of non-ordinary holotropic states that would happen to us at the moment of death and after we die. And I think this, you know, the spectrum of possibilities, I think, is very broad, as you know, the spectrum of the transpersonal experience is in psychedelic sessions or holotropic sessions or spiritual emergency. So I have seen people and have experienced myself elements of what's described in other cultures as the posthumous journey of the soul. They are very different models. There's not general agreement as to what that posthumous journey would look like. It's different in the Tibetan Book of the Dead, is different in the shamanic cultures and so on. But I think it would be some series of holotropic, transpersonal type of experiences, probably on a very wide spectrum, from hellish to, you know, celestial, paradisian type of experiences, and anything in between. Now there is an indication that there is a situation where at a certain point you lose consciousness. There's some kind of a interruption of the posthumous journey between incarnations. But there are some indications from Tibetan literature that with special training it's possible to maintain consciousness between incarnations, even to the point of deciding your next incarnation and so on. Now those are very, very fascinating anecdotes. There are stories that are kind of quasi-scientific verification of that, which are the stories of the tulkus or the lamas, where they not only discover the reincarnated person, but they conduct certain tests where the child has to recognize, out of a set of objects, the one that belonged to the previous incarnation and so on. So there are a lot of fascinating, fascinating anecdotes of this kind. I think ultimately it will remain a mystery, no matter how far we think we get into that area. Well, if I should sort of look at all the experiences I have had over the years, it's now more than 50 years, and also experiences I have seen in others, I would definitely move